Hello everyone. Today is day 40. It is August 6th. I am doing a voiceover here of this video to show you what my physical therapy appointments have been the last 4 times that I've gone. I go Mondays and Wednesdays, and basically it starts off just like this. She usually puts the arm on a pillow, has me lay down on the bed, and massages the muscles around it. She has found a few muscles that are really tight, and they're in my rotator cuff. She has labeled them the teres minor as one, and I cannot for the life of me remember the name of the second one. But basically there's one on the back side of the shoulder and one on the front side of the shoulder, almost in the armpit. And she massages them here for probably a good 5 minutes or so. So while she's doing that, I'll explain kind of how I've been. The last week has been really good. I did bump my arm Thursday. I was walking around the house, didn't have the sling on, and I bumped the palm side of my hand against the chair as I was turning to my right, so it forced my arm into an external rotation type of motion. Now, it didn't actually externally rotate, it just was a quick bump, but it hurt a lot, and I immediately put the sling back on and iced it down, and then I wore the sling the entire next day, even though I was really not doing anything and I wouldn't have worn it otherwise, but because I had bumped the arm, I did wear it. I was telling her about that here during my appointment today, and she was giving me a hard time for not wearing the sling all the time like I should be. I also told her that when I wake up in the mornings, I have some soreness on the top side of my shoulder. She figured it was the deltoid, and she tried to massage that out a little bit. That actually didn't hurt too bad when she was doing that. The part that hurt the most was the back side of the shoulder and the front, kind of up underneath in my armpit area. When she has me lay down on the bed, she wants me to start first working, doing some kind of just some bicep lifts, nothing real special. And then she proceeds to try to move the arm. Right there, she was really working that muscle that was really sore, and I actually had to have her stop because it hurt too bad. The motion that I've had in the shoulder so far has really been 90 degrees and 90 degrees. So 90 degrees up kind of in front of the body, and then 90 degrees perpendicular to the body, so kind of out to the side, which you'll see here when she gets started. I'm not actually breathing that hard, it just appears that way. So when she brings the arm up, you can see how tight it is and how much it hurts, but also how much I fear the shoulder popping back out. It's very evident here. At one point I told her, okay, I really can't do that, let's try to move it the other way. And so she worked the outside shoulder. When I popped my shoulder out and they've tried to put it back in, they failed a couple times, as I've told you before, and they damaged the nerves. Because of that, whenever I would lift my arm, I'd get to about 45 degrees in this lateral rotation here, and then I had to shrug my shoulder to get it any higher. My focus when she's doing this is to try to make sure that the shoulder isn't shrugging while she's doing it. Once she's done with the lateral movement, she works onto an external rotation and an internal rotation. She goes basically to neutral, which is about the top there, and it's not externally rotating. She just goes to basically to 0 or 90 and then works in. And it's just kind of getting the arm and the shoulder and the humerus head used to moving in that direction to get the fluid and everything moving within the joint. She tries to work the top again, and you can see that that's the part that I have the most problem with as of right now because it does hurt so much. I had asked her about the coming weeks, and she said that I will be using some pulley systems. I look forward to that because I foresee that being the most beneficial. I'll probably see results the quickest with that, and it's something I can actually do at home. With this type of passive movement, I can't do this by myself. I actually need somebody else to move the arm. So when it can be done is actually extremely limited to whenever my wife has the time to be able to sit down and really do this with me and spend a good 30 minutes just moving the arm. She starts every session with a bit of a massage and ends this one with a bit of a massage. I asked her if she could do the I think it's called a graft tool, basically that metal tongue depressor to work the scar tissue. And she said that she wasn't going to do it this time because she did it so brutally the first time that it actually bruised, and she was going to wait for that to heal. Now, the other lady I saw Monday was much nicer with the tool, and every session ends with a nice ice bath. So all in all, this week has been very good. I will continue to post, and I'll keep you guys updated. So thank you for staying with me, and I'll talk to you all soon.